Welcome back, everyone, to the Pursuit of Health podcast. I'm your host, Dr. Eric Vetke, and today, on episode 4, part 2, we continue our discussion with Dr. Lisa Sassi. She's a nurse practitioner at a large New York State public school. In part 1, she shared with us her team's experience as COVID-19 entered the borders of the United States. She took us through the early spring and summer of 2020 as schools closed and then as they tried to reopen. Here, in part 2 of episode 4, she shares with us the more emotional side of dealing with this pandemic, with loss of some of the families that her students bring to her attention and how her staff deals with that. She also goes into depth about some of the other issues that American immigrant students are facing as they enter our country into a public school system, particularly in the middle of a pandemic. She shares a unique experience that she had with one of her students who left a memorable impact on her for the rest of her life, only after she gave just a little kindness and changed his life, and hers as well. So, she shares at the end also what she's learned from this as we look forward to many more months, perhaps, of dealing with this pandemic in 2021. We're glad that she sat down with us. We hope this is informative. So, join me now as we sit down with Dr. Lisa Sassi. And this is a health issue, and it's nice to know in this large school system that the clinician, you, has been involved in that. And I think that's important, and I hope that calms people too, and that we are doing your best. And when we see, our politicians and our representatives trying, at least they're turning back to our Commissioner of Health,
Sure.
or turning back to their, Department of Health people and doing that. And I think, to me, that's hopefully reassuring to people too, that somebody with an epidemiology background in nursing, who's part of the community and been here for a while, has been involved in the process. A couple more questions on this, and then I would like to touch briefly about the immigrant issue that you've been also dealing with and working very passionately with. But, the sad part of this, how has the emotional side affected in terms of people gotten very sick, or has anybody in the school system, parents or kids, actually gotten so sick that they're not in school or sadly passed away?
Early on, in I guess April, when we were not in session, well, a parent did pass away. It was a parent of a young kid in elementary K-1 school. And I heard of it through, a friend who's in the district, but, when sent me a text, and I reached out to the principal, and they did know, and they reached out to the parents, and it's a real supportive elementary school where they, reached out and offered a lot of support. Right. It was devastating and scary, and at that real scary time, and you thought, wow, this poor little one is, kindergartner, first grader. Right. So they kind of connected together. And since then, we've had sick parents, hospitalized parents out of the hospital. And it really just kind of, when the building knows about it, on the building level, they are supportive, and I know from my nurses at one of the elementaries, ran and got food and brought stuff and just dropped it on their door just because, she had called them to see about the absent or contact tracing question. Sure. The parent just sounded awful. And, we've always had collections and gift cards, and we do have an outreach kind of, some people that do some home visits, and there's gift cards, or let me buy this. And we just send it off and somebody drops it, at the door for them, really without asking, or saying much of anything. Just, here's this, we had it, please take it. And
it's
walk
instinctive.
Away.
It's not an issue.
Yeah.
It's a given, right?
Yeah.
And some of the staff, teachers or other things, because that's under your purview too, and the coaches and stuff like that. Has that there been anyone sick in your school to that level?
To that level, not.
I'm glad you're pausing.
No,
that's a good thing. You're pausing there.
I'm sure I would have known for sure. Right. There's been one or two hospitalized, but out.
Good. That's great news.
Yeah, so that's good.
That's good news.
Yeah.
And that's kudos to everybody doing their best at work and trying to do that. We're at that point too so far, and we hope that continues. But I think, you have a lot. You have the students, you have the communities, you're interacting with other schools, and you have all the staff and the people in the system. It's a public school system and especially a system your size is very intricate and complicated. There's a lot of people interacting with the community, and so I think that's important. We think of the issues of government versus public versus private and all that stuff, but the truth is our public school education, particularly in New York, and is very strong. And I think you brought all your resources and all your people together in a tough time. I wish you well as it continues through there, as you try to get the sports going through the next weather. We've been doing that together last weekend as we met about 60 some kids who had been affected and made sure they were all right, and talked about a consistent approach there, and hopefully we'll continue to do that together. But something you mentioned as you were dealing with this, and you've alluded to, and I think we should spend a moment on that, which is, we were talking about this. We're the land that we're proud of our history of receiving immigrants, to give us your huddled masses, you're tired, you're poor. We don't live far from that statue. And you are in a community which is a suburb of New York, with a population that's growing. And as you said, from people from all different parts of the world coming in. And having grown up here, I don't think I saw that same population mix, which actually was one of the reasons I came back, because I found that to be exciting to see that change. But that has another side to it that you're noticing, which is that when someone comes and a child comes from another country, they may not have access to all the things or know how to do that. And you found that become part of what you're doing lately.
Yeah, every day it's difficult. You move to another country, don't speak the language. Many of the kids did not go to school, and not all, but a percentage of them from 3rd, 4th, 5th grade on. The travel from where they came from, Honduras, Guatemala, Mexico, it takes a while, and it's a process. And then how do they get here? So they haven't been in school. Now you put them in a big high school, and they don't speak the language. So we have a lot of programs. I was just meeting with Karen, who's one of our directors of their programs, Morales, and we put together a newcomer program, and they go to school about 4, maybe 5 days a week right now for the majority, but not all. Once they're more comfortable with the language, they can log on, or if they're not comfortable being in the building, they certainly have that log on. With
the COVID, right, especially, yeah.
But they, it's hard because their parents work, and their parents, with COVID, they still have to work and pay. And how do you even find an apartment? So they often live with people that are their family, or a friend of the family, or a deemed family, or somebody. And
which is how a lot of the stories of immigrants in the past, no matter where people came from, there was somebody you knew. You came to the country and someone helped you out.
And congregated together. Right. So my grandparents were from Ireland. They came into the Bronx.
No different. Correct. That's how it works. So you're seeing that.
Well, we're seeing that. But they don't speak, the language as opposed to, so we want to get them comfortable with that. Right. So there's a lot of things now, fortunately. We used to type, if I had a question and I didn't have a translator, and we do have bilingual social workers and guidance counselors that help us, and they're great. But they're, you can't keep knocking on their door for everything, and we could type on Google Translate and they can read it. But they put in classes where there is a class, maybe a history class, where the teacher is bilingual, but he's a regular ed teacher. So he can teach it in English and Spanish, and the students can be there. And the goal is to transition them into not just stay with their little cohort, to broaden and be part of the school community.
Certainly, which is good for all the students to see that.
Good for everybody. Yeah. It is, and good for them to see what America is all about. Right. And including, I think last year there was some new little guys in the middle school, and they wanted to play soccer. Soccer is their sport in some of those countries.
Yeah, Central America, South America,
they
wonderful.
Are. Yeah. So I ran down to do a quick physical on them because they didn't have a doctor, and make sure they were okay so that they could come.
So that's a pause there for a second. They didn't have a doctor.
No.
You're their clinician now. They come into the school, but you become the school nurse becomes, at least at the entry point, their first contact with medical attention.
Right. Some of them hadn't, ever had, we've detected scoliosis. You've detected, things probably you've seen some of them.
Right.
We do have a school physician, Dr. Golson, we work under, but I can do a school physical on those to make sure to get them out and playing a sport. And, it's timely. They come in and the sport begun the week before, and the coach will let them have a tryout because they're brand new, and you do that for any student, any new entrant. So I ran to do a physical for them, and they got to get on the soccer team and play and loved it. And then came, do they have cleats? And let's get them some supplies, and who has this and that. And then they played.
You open that door, and it's kind of that is that outreach, that we're supposed to be representing, and that's how it actually happens. But I think it's to me very encouraging to know that our public school system, which is let's be honest here, it's our government-based, state-based government system, also plays the role of outreach to people coming from other countries who don't have healthcare resources, and as a clinician, as a doctor, seeing that may be the inroads to the healthcare system too. I mean, a lot of us don't pause and think of it that way, that the school system may be the inroads to the health system.
Sure, because, I didn't have no idea this went on at schools. My children are older.
Right.
I think my youngest was 7 or 8 when I started working in a school. I've done ICU and recovery room and all sorts of different types of nursing, as well as in an occupational office as a nurse practitioner. And I didn't have any idea it was this, which is what makes me keep interested in it, because every day is different. Yeah. And, you like the difference and the challenge and the, change. So I had no idea this went on.
And we see, teachers, and we're all appreciating the teacher's role through all of this. And we're hearing a lot about that. But I think the role of the school nurse is someone that everybody knows is there, but to really think about it as someone who represents us, our community, in terms of outreach to people. And what have you noticed? Can you tell us a story, for example, about anyone who in particular struck you as to the evolution from when they first came to you and then how that evolved? Give us an example.
I told you a part of a story once with a guy that I was a student, and he was the sweetest guy. So he moved here to the country and first lived with his aunt in Newark, and moved up to not an area that he wanted to stay in, or the aunt didn't feel comfortable having him in school there. So he moved to ours, and by then his mom was here.
So he was concerned that wasn't as good a school system.
Right.
Safe and all the other issues.
Right. And they were concerned.
So like everybody else, that's what they want for their family.
Right. Everybody else, brand new. And I cannot remember, he was from the country where Messi, the soccer player, was from. So whatever country that was, I knew it at the time, and I don't remember now because I just remember him.
We'll get that response, I'm sure, after this, but yeah. Okay.
So he was a good guy. So there was some issues at home. Parent had remarried, and, he was a boy that had made his way to this country. He lived with an aunt, and so he was a really good-hearted guy. Going to classes, nice kid. So we always give a little Christmas present to each other in our office, only 3 of us. And instead we decided to buy something for a student. And we had done that prior, and so we picked him this year. And my kids, I knew he was a soccer fan, and my children are big soccer fans. And I told them where he was from, and they said, you got to get him a Messi jersey. So I bought him from Eurosport. It was a nice one. Well, it came, and my son had cleats as well that he bought and wanted to give it to him. He said, I don't like them. For me, I think he'd love them. They're brand new. He'll love them. So I bring him the presents and the cleats, and he opens the present and closes it. And he's a big guy, and he starts crying. And we start crying. We didn't know what I did, if I was insulted him, because he's a proud guy.
What did I do? Right.
He's 6 foot at least.
Did I offend him, or is he happy? Right?
And he opens it slowly and said it was his birthday, and that was the best present he ever got in his entire life. And it was a Messi jersey. So he loved it. The next time school came back, or it might have been the day before, Christmas, he came in with presents for us that he bought and wrote on just paper, and a thank you note for the 3 of us in the office. The next year, he bought us another present, and I still have it. I put it out every Christmas, a little angel, and wrote something. It meant so much to him. I bought him a next present the next year, but nothing topped that. And I still remember it. And, he graduated, and he did send on Mother's Day flowers. He worked then in a florist to us. And I hope he's well. I do have his email somewhere, because that was a little over a year ago that I last heard from him. But he was a wonderful person in his heart with a difficult life situation.
Yeah,
And,
which you turned around. And,
I hope. I mean, I think he remembers that, and I certainly never forget him.
Yeah.
So
it's a win-win on both
It is.
sides. And do you find in your work, what are some of the hurdles that you've seen of the immigrant population who's trying to just find a good school system, a good education, the American way, education, and we're proud of the school system around here. And so why wouldn't people want to try to do that too?
Yeah.
It makes sense. We all want that.
the parents work so hard and want their kids to go to school and to learn to learn the language, and that's what they'll say. Is I just wanted them to.
So what are the biggest hurdles you see them face in lately? What are the things? And is the getting back kind of to the COVID, is that affecting them more deeply, perhaps, than other kids?
I do think so. I think financially, I don't believe, unless they're legitimate workers, they're eligible for unemployment. There is food, and I do think they can get food stamps, but at least they can get it from we have a great food pantry. But, all those basic things when everybody was paused and people weren't working for a good month, that's huge to them.
That was tough.
And so hopefully, they've rebounded. I mean, we did, there was outreach, and there's a lot of community stuff in Monroe itself through the church and through the temple. The temple had arranged for dinners for families. So, so the two, everybody and work together. The food pantries you hear are way up. And could it be that, now they're losing their income? How are they even making ends meet, if they're not eligible?
Trying to come into a country, trying to make your way, it's going to be tough. And then this all hits.
Or if they get sick, can they stay home?
Right.
And not work?
Can they afford to stay home?
Can they? And then once you know what happens when you report, are you going to report? You have to isolate. Can you do that?
So this intrinsic system that we kind of have, where people, may be coming here for all the different reasons that immigrants come, and that's, that's personal, and there are themes, and we all know about that. But in terms of the interaction of these people coming to try to have a better life, coming into a suburban community, not too far from New York, and trying to have that for their kids. And then COVID hits, and all of the issues of how people come into the country and what resources they can have, everything from food to healthcare to housing. It all actually becomes a public issue. It affects their education. It affects everything. And you're the point of contact for that. You see that.
Yeah. Yes. I mean, in the building, believe me, it's a huge team.
Right.
I may help a little facilitate, but there is the bilingual people that are much more the ones hands-on. But it's a huge issue. And I don't think people are aware of it. And
That's what I mean.
honestly
Absolutely.
was not fully aware of it until for the past 18, 19 years I've worked in the school system and seen it more and more, and then realized, wow, I hope they're not eligible for unemployment. Are they able to pay their rent? And, I'm sure they don't have... The rents are not cheap,
And that explains why, people are always talking about, why different people of different backgrounds and different socioeconomic backgrounds, including the immigrants, are being affected differently by this particular virus. But it's not just this virus, it's healthcare in general. Even before this was an issue. This just blows it up to a very big level, but it was always been an issue. And as a clinician, I think both of us probably say, this doesn't work. There's got to be done a little bit better than this. We've got to find a better way to help with this process.
Yeah, I agree.
Yeah, and I think that's the kind of future we're both looking forward to say, we believe in our nation of immigrants. That's how we came here. So can we do better by them? And to know that one of the inroads to that is our public school systems. Sure. That's where they find that common place that we all raise a community from, and we're all part of it. To see that your community did the outreach is wonderful, because again, community raises a child. I think that helps everybody when we see that. Yeah. But the health implications, I think most people don't realize. that.
Right. Yeah. No, you wouldn't until you know. You don't.
Right.
I think you have to walk in their shoes. You cannot have an idea, and I can't even begin to know, but I know what I've heard from the many years, and speaking to the children and watching, and the parents and hearing them just want their kids to just go to school and to so much better, and to do better than they did, which is what we all want.
Which we all wanted to, and so pursuing health for these people who are trying to survive not just COVID, but day by day anyway, and trying to follow the American dream is what I hear you saying is that the community does that. It's done through a community.
Yeah.
They can't do it on their own.
It's hard, you know, you don't speak the language, you have to know that it's available.
Right.
They do network amongst themselves, like
correct,
of our, which is great.
All immigrant populations have done that.
Yeah.
But the in terms of access to staying healthy, which how can you work and do all this stuff if you're not healthy, and trying to always make those decisions about should I go to work or should I stay home? Should I do all this? Some of the things that not many of us face or have to face, thank goodness, every day. But that ability to level the playing field starts in the classroom sometimes.
Yep.
Yeah, it's very.
Our district is great about reaching out and trying to really support them, which I think is good. You want them to know school is important. School is here to help you. Right. Don't be afraid of it. Back to the fear. Come in and
right, and then
we'll do what we can to help you.
And because the kids are seeing that and being part of it, they're not buying into this idea that those people somehow threaten them. That whole other dynamic doesn't have to play.
Right. This is safe.
When you realize that everybody is here to make everybody safe, that's a lesson that hopefully could have much broader implications for all of us.
Yeah.
That'd be wonderful. So I'm glad we talked about that for a moment because, again, I don't think most people actually pause and step back and look at that piece of it.
Yeah.
So thank you. If you had to basically look back at your experience through the COVID and in general as a nurse, but looking forward, we kind of try to ask the same question at this podcast, at The Pursuit of Health, which is, what does the pursuit of health mean to you in your profession, in your healthcare field, especially with what we've been talking about? What does it mean for our public school system, for our communities, for America to say, if I'm looking towards achieving health and pursuing that as a goal, how do we do that?
It's such a hard question.
Yes, yeah.
So the word I was thinking when I had known that was going to be a question is fear. I think people operate under fear in so many ways. So I'll maybe and to try your best not to do that. Yes. So when a teacher would be afraid of something, do you think I need to go to the doctor, for this? I was having, yes, what you're afraid. What are you afraid of? The sooner that you get in there, the better that it is. And the same for any part of it, whether you're anxious and your fear of making a change or switch or coming into a building, try it.
Yes.
The operating under fear is not good for your physical health as well as your mental health. And it's not good so you need to be proactive and go to the doctor and go to,
Excellent.
Something that makes you a little bit uncomfortable. So I don't know if that's exactly answers your question.
No, but absolutely. Trying to take control instead of having control you.
Exactly.
Which is what fear does.
It does. And it leads to more damaging, if you simply went and had it checked out. And when we did the heart screening, parents were somewhat fearful and very grateful that you were there to look at their students and to come into an environment that was open and fear-free.
But they took this step forward and faced that.
They did.
Right. That's that bravery we talk about, that American bravery, the land of the free and the brave, right? Yeah. What does that mean? And when it comes to facing something health
uncomfortable, whether it's in getting your medical help or getting your emotional help or facing something that makes you a little uncomfortable, you do it with caution, but do it. Don't let it hold you back, because that will only lead to more damage physically and mentally.
I think that's great advice, because fear that controls you becomes panic.
Sure.
And then that doesn't work. That's very ineffective, and we can't get the next step. And I would dare say compliment this as a pediatrician, that I find the bravest people to be the mothers.
Sure.
Okay.
Yeah.
As a male, I have to admit that. To
and
everyone.
as a mom, I agree.
Yeah. And I think, and us men sometimes stand right behind those wives and mothers and loved ones to help us with that, because they do have that bravery, because their focus should be more on themselves sometimes, but it's definitely on their families and their kids. And I think bravery is helpful to get through this. So as the nurse of a large public school system, what kind of resources would you tell people are available to them? You have the school website. What other kind of things if a family is afraid?
We have a lot, so we have a lot. With our school psychologists and our pupil personnel department, they are just arranging, and it might be available to all, but it's not up yet, something on the mental health piece, because COVID's brought a lot of stress, and not being in school brought a lot of less eyes on students that otherwise would have had it. So they are putting out a website with all sorts of relaxation advice and techniques for students, because not everybody relaxes the same, right? And so some people like art, some people like drawing, some people like running, so they have all different activities on mindfulness as well as resources. We have resources on where to send kids. Sometimes it's insurance based, and but there are some walk-in places for the mental health that you can go to here in Orange County. Access has a walk-in as well as the hospital.
So would they look on the school website? Or
the school website, it should be posted soon. They put it together. It was so amazing, like all different, it takes a long time to go through it, but so that should be there soon. So that's for the mental health piece. For physical health, we work with them, on arrival, and we'll talk about the immigrant students and newcomers to the country. If they don't have insurance, they need to get vaccinated, which goes through the Department of Health. But how do we get them on insurance? And in New York State, it's free up to through age 19, I think.
So what is that website that they would access?
So we have a paper, because they don't get right on their computers and don't all have access to phones even. So on arrival, we have a registrar. We have a I'm not sure if she's called that, but it's a registration person. Sure. And she will register the parents. And then we have a paper that has, besides the Orange County Department of Health, which before COVID was vaccinations and those sort of things, it has some insurance navigators. So they're from Child Health Plus. It has the website of that. It has phone numbers for bilingual navigators. It has phone numbers of places that are, kind of sliding scale. We have some places locally that they can go to sliding scale while they're uninsured.
Great resource.
And we printed it in English and Spanish.
They can get that at the school?
Right at the school, yep.
Can they go to the department, school department too? Or
might be on my nurse's website, but if not, better check that.
All right. Definitely
the immunization clinic is, but that list of local providers. So then there's the pediatricians locally in alphabetical order, so I don't hurt anybody's feelings. And but then we also need to make sure there's the sliding scale so they know where to go. So we start with those for the insurance navigators on the free insurance, the Child Health Plus. So we have that in writing, English and Spanish, and it was on the website. It may not be on the website now. I haven't looked back, as well as low-cost dental providers, because we are that's a requirement by New York State.
So taking care of their health and their prevention and all that stuff. So the school clinician, the nurse practitioner is saying, use your school as a resource too for your health, not just your education. They're interacting with each other right now. They do. Yeah, very good. Well, this has been enjoyable to sit down. We talked about doing this, and we can keep doing this, as we can tell. And that means because we care about what we do and part of our community. So I thank very much Lisa Sassi, the nurse practitioner at Monroe-Woodbury High School and a school district in Orange County, New York, not too far from New York City, that has definitely evolved over the years, has gone through, like a lot of the other communities, the COVID-19 experience. We're still in the middle of it, and has learned some lessons, and there's still some hurdles to do, but has said when we do it together and we face fear together, then that's the best chance of being successful here.
Totally agree. Thank you so much for having me.
Well, it's been a pleasure. Thank you again. Well, everyone, I hope you enjoyed our time with Dr. Elizabeth Sassi. I know I got to see things differently through her eyes. Someone on the front lines dealing with the issues in a public school. We've all heard about these issues on the news, and it's good to know that someone like Dr. Sassi is there, taking care of our children, communicating with the community, and also learning as she goes with a strong background in epidemiology and nursing. So if you like this particular topic or have ideas for other topics, we'd like to hear from you. We can be reached at drfetkemd.com. That's drfetkemd.com. We can also be reached at the same address, Dr. Fetke MD, on Facebook, Instagram, Twitter, and now TikTok. We look forward to some of your ideas and feedback because, again, health is about all of us in this country. So until then, I'm Dr. Eric Fetke, wishing you well in all your pursuits.